Thank you all. Thank you for having me here. I've learned so much over the past few hours. It's great to be a part of this conversation, and I will keep an eye on the clock because I know I want to respect your time as we're getting close to the end of the day. As Katie mentioned, how do we go forward? We're going to talk a little bit about employers' perspectives on how we can be helping with community health. The center, I'll just tell you, is an affiliate of the Greater Houston Partnership. We're sort of their research arm that's been tasked with looking beyond the horizon at issues and opportunities that affect our community. And so in that vein, we've been looking at our energy transition, health and health equity, and we're starting some work in visioning for the year 2050. As a part of our health and health equity work, we've done this research looking at the economic impacts of our healthcare industry and the economic impacts of the health of our Houstonians, and we've done some deep dives into some specific topics. The trend that we've seen as we go through all of these is that Houston has this paradox of plenty that we've talked about today. We have the world's largest medical center, some of the world's strongest medical resources, but we don't have the best outcomes, and that has to do with these social determinants of health that we've been talking about all day today. So you guys know these statistics better than I do. You know, our diabetes rates are higher than average. Our adults are rating their health more poorly than average nationally. So, you know, we're looking around and we're wondering, why is that? What are we missing if we have the best health care and we have these great employers and we do have a lot of these social service organizations, we have great health departments. What are we missing in this? Where can we go from this? And so we've looked at how do we bring these people together. And what we noticed is as we're having these conversations on health, there's a missing component at the table. Time and time again, we did not have employers there. And when you think about it, employers really are paying the lion's share of our medical bills. They pay either through payers, insurance, they pay through productivity of their employees, whether their employees are missing work or they're at work, but they're distracted because they're not feeling healthy or they have a family member who's not healthy, and they're paying because they are, in the pandemic particularly, impacted by the health of the whole community. If your supply chain, if your customers, if anywhere along the line you have a lack of health, that affects all of our employers. So how do we bring them to the table so that they're talking to and about these issues? And why do we bring them to the table? Here's a few statistics about, you know, what the bottom line is for our employers. It's costing a significant amount of money. The health inequities in particular are costing a specific amount of money, estimated to reach $1 trillion by 2040. A lot of the issues are going around these missed work days, the loss of productivity, and a lot of the ways that our employers are addressing this right now is through EAPs. I'm sure y'all are more familiar with those than I am, but they are underutilized. And this is the key thing when you go to an employer and say, you know, what are we doing to help your employees? They say, well, we do offer this EAP. Nobody uses it, but it's out there. So they do want to do something better. We then convened a roundtable and then had a few side conversations, smaller conversations out of it. Actually, Katie helped bring together the membership of the Greater Houston Partnership to have this roundtable conversation about what the employers are thinking when they're thinking about community health. And they are interested in it, they are concerned about it, and they do feel like they're putting money into it directly, but they're not putting it in the way that they would like. They would like to be able to target their investments at the communities where their employees live. And they would like to be able to target those in ways that would impact the health of those communities, but they don't really have an easy way to understand what that is. Then after they've put that money forward to support a program, an intervention, something maybe that Houston Health Department could do, they would then want to see some report on metrics of, okay, what did I get for that investment? Did it actually move the needle? Are we doing the right things here? They also don't want to be alone in this. They would want to be able to pool their funding with others because one company, even if it's a big Walmart or if it's your tiny corner store, they're not going to be able to solve healthcare by themselves, right? And so we were thinking more about this. We partnered with a large air conditioning manufacturing company, Daikin. They have about 9,000 employees in the Houston region. It looks a lot like Houston. They speak 27 different languages on their floor. Very diverse organization. They offer healthcare to all of them. And we looked at how can we see if we can, test out these theories of, can we get you this data so you can target the intervention, and can we measure the impact of these interventions, and how would we understand what interventions to work on? One area they were focused on was maternal health, because it's an issue of concern for our region. Our region isn't doing as well as the rest of the state or the rest of the nation. So in working with them, we came up with this kind of idea of doing the data analysis up front, because as we've talked about today already, we have all this data and we can crunch the numbers and say, okay, we can see where your employees are. And we can see through your claims data what the health issues are that you're having, and we can put together a picture of where you could be focusing your efforts. But you also need to contextualize that through some community conversations, and then create sort of this funding mechanism. And there's really neat funding mechanisms that are in use already. They've been thought of in academic institutions, but they've been implemented in different cities that we could leverage. So testing out the theory, we looked at the data from Daikin. They were able to share their anonymized claims data with us and let us know kind of where their employees were located. We found a community that has a concentration of Daikin employees, and that community also has some social vulnerability index risks, and we have some different factors that made it interesting to dive into and understand. So we did a assessment, because now we understand what's happening with the employees who live in that area. We then dove into what's happening in the whole area. So these statistics are not talking about Daikin employees. These are talking about everybody in those 3 zip codes. We were able to see, what is causing the poor health in this area. They do have higher levels of obesity, to diabetes, to lower life expectancy. This is a trend you see time and time again. Then we're able to look at other factors like, they have a struggle with physical inactivity, and they have a struggle with poor mental health. Those are the key factors that were reported that would be driving these sorts of medical issues. Interestingly, these are the same things that are driving cardiometabolic syndrome, right? So it still relates to the conversation here, even though that wasn't our primary focus. Our next step was to do a landscape assessment and understand what resources were there. And you automatically go to, if you have obesity, maybe you don't have nutritious food. That's not the case in this community. We saw that they do have good access to healthy foods. They do have good healthcare resources available. There's a good FQHC available in this community, but they are a very diverse, large immigrant community, not a lot of English language, or a lot of English as second language individuals. They have long commute times, and they have limited opportunities for exercise. So that kind of points you to where an intervention could be. We've not been able to move forward on this to help with the contextualizing in the community, but we were able to find some organizations that Daikin could partner with. The FQHC is called Hope Clinic, partnering with the Harris County Public Health and Healthy Start to start working on how can we work with these communities to understand how they could be affecting the health outcomes in these communities. So now we weren't able to get to these next steps of this community engagement, but there are some questions we really would love to be able to ask, to understand, is it the language barrier that's limiting the use of the healthcare resources? Is it a lack of green spaces distributed, or a lack of walkability? Understand what the long commute times are having to do with this inability to incorporate exercise. And then, once we have that information, we could find some solutions that would work. And so, looking at patient education that's in all the right languages and culturally appropriate, and trying to remove those barriers to exercise. But one interesting idea that I had thrown out by, I'm forgetting exactly who tossed it out, but a community member or somebody who had worked with the community before, was this idea that people in this community have an interest in having night markets. And that would be a culturally appropriate way to get people outside, exercising, addressing some of the mental health concerns because they're finding a way to have community. So sometimes when you can have those conversations to contextualize the data, you can think of ideas a little bit outside of the box that can address issues and can be something that communities can pool their funding in and try to address these health issues one community at a time, because like we were saying earlier, I think there's no one silver bullet. So this is one way of an angle, a possible model for bringing employers into this conversation. So that's sort of the model that we've come up with. Hopefully we'll be able to pursue it more in the future and find some more ways that our employers can be engaging in this work and can be helping make our communities healthier. Thank you all.